Hi everyone. Today's topic for discussion is on nasal septum and its disorders. What are the parts of nasal septum? Nasal septum can be broadly divided into three parts, that is the columnar septum, the membranous septum that you can palpate which is membranous, and the septum proper which is seen posteriorly. Okay, so this whole part will be the septum proper and this small area will be the membranous septum, and the columnar septum is the part that you see here, which is formed by the medial crura, which is fused together. Okay, medial crura of the lower lateral cartilages fused together to form the columnar septum. So totally you have got three types of septum. Okay, that is the columnar septum, membranous septum, and the septum proper. Okay, so what are the parts of septum proper? Septum proper is formed mainly by the cartilaginous septum, that is the quadrilateral cartilage that you see here. This is the major part of the septum proper. Along with that you have got bone posteriorly. Okay, posteriorly you have the perpendicular plate of ethmoid and the vomer. Okay, perpendicular plate of ethmoid and the vomer. If you are asked to name three main structures which form the nasal septum, these are the three main structures that forms the nasal septum. Okay, along with that there are certain contributions coming from the nasal spine of frontal bone, as you can see here, and also the nasal bone, and also from the nasal crest of maxilla and the palatine bone. Okay, nasal crest of maxilla and the palatine bone are also giving some contributions to the septum. Okay, the vomer and the sphenoid sinus rostrum, they are forming a joint which is known as the Schindler's. Okay, rostrum of sphenoid and the vomer forms a joint called Schindler's. Okay, it might be asked in your anatomy as well, right? Schindler's is formed by rostrum of sphenoid and the vomer. Okay, in the septum proper. Now, what are the problems associated with nasal septum? First of all, you have the deviated nasal septum, which is the most common problem associated with nasal septum. Even though nasal septum is seen in up to 80% of the individuals, 0 to 80 is the broad estimate of the people having deviated nasal septum, most of them are asymptomatic and requires no intervention at all. Only when nasal septum is causing problems, if the septal deviation is severe enough to cause problems, it will be something which requires intervention. Now, what are the causes of deviated nasal septum? First of all, it can occur due to some trauma to the nose that can result in a nasal septal deviation, or else it could be due to a congenital problem, that is due to a birth defect when you are descending down the vaginal tract because of the trauma that the child encounters during its journey through the vaginal tract. That can result in a deviated nasal septum. And there are certain racial factors associated with it. Okay, that is, it is more common in whites when compared to blacks. Okay, so it will be more common in Leonardo DiCaprio. Okay, if you are estimating the chance of who is having more chance, it will be for Leonardo DiCaprio. Okay, now another thing that you have to look for is if the patient is having any cleft lip, cleft palate deformity. In that case also there will be deviated nasal septum, and when there are adenoids, it can result in high arch palate, and that can also result in deviated nasal septum. And if there is a family history, that is also associated with deviated nasal septum. Okay, so what are the factors associated? Risk factors include: 1. Trauma, 2. during birth. Okay, so during birth there can be trauma, and then it could be due to a cleft palate, adenoids. Okay, racial factors and family history. Okay, so these are the various etiology postulated to cause deviated nasal septum, even though deviated nasal septum is more common than a straight septum. Now, what are the types of deviated nasal septum? As you can see here, this is the normal nasal septum, and this type is seen only in less than 20% of the population. Okay, and yes, C-shaped DNS can occur. Then it could be a dislocation of the caudal septum, caudal dislocation, and for you to see caudal dislocation, you will have to lift the nose upwards and look from below. Okay, if you are looking with a thudicum speculum straight away, you will be missing that caudal dislocation. Then you have the S-shaped DNS, and it could be a septal spur. Okay, it could be a septal spur at the bony cartilaginous junction. There can be a shelf of bone, that is what is known as the septal spur, or it could be thickening of nasal septum following septal hematoma. There can be organization of septal hematoma, and that can result in a thickening of nasal septum. Okay, S-shaped DNS also can occur. Now, how will you deal with a patient who comes with deviated nasal septum? First of all, the patient will be coming with some features of nasal obstruction, right? As I already mentioned, you have to ask the patient to look upwards like this. Okay, or you can just tilt the nose upward like this to see the caudal dislocation of septum. Okay, it will be missed if you are straight away going to use the thudicum speculum. Okay, now what are the complaints with which a patient comes to you with a deviated nasal septum? The patient will be having nasal obstruction. Okay, and there will be nasal discharge post nasal drip if he is having sinusitis, if it is a posterior deviation, or if it is obstructing the area of the osteometal complex, it can result in sinusitis, right? That can result in nasal discharge post nasal drip and features of sinusitis, and headache can occur. Okay, headache due to Sludder's neuralgia can occur. What is the Sludder's neuralgia? Sludder's neuralgia. It is the terminology used to indicate when the deviated nasal septum is compressing on the lateral wall where there is the anterior ethmoidal nerve and it is getting compressed. That is what is resulting in Sludder's neuralgia. This is actually not accepted nowadays. Okay, this kind of headache due to a nerve compression is an olden theory. It is nowadays discarded. Okay, so these are the various clinical features of DNS. So there could be nasal obstruction, headache, sinusitis, anosmia, external deformity. Okay, due to deviated nasal septum, there can be external deformity as well, and so sometimes patient will require rhinoplasty along with septoplasty. Okay, so what are the tests that have to be done for a patient suspected to have deviated nasal septum? You have to do Cotil's test. Okay, this is a coat, right? This is a coat, so you have to do a Cotil's test. What is this Cotil's test? How will you do it? This is to check whether the area of internal nasal valve is having the obstruction. Okay, internal nasal valve is having the obstruction. So, if you are having obstruction in the area of internal nasal valve, what is happening when you are trying to move the cheek like this? That will result in relief of the obstruction when you are doing that. Okay, this relief in obstruction that is occurring when you are moving the cheek like that, that is indicative of a relief after the surgery. Okay, so you can proceed with the surgery if there is relief like that. Okay, now there used to be an olden dictum that whenever you are having a deviation anterior to the Cotil's line, this is the Cotil's line, okay, between the nasal spine of maxilla and the nasal spine of frontal bone. Okay, between them, when you draw a perpendicular line, if there is a deviation anterior to it, it can be treated by septoplasty alone. Posterior to it may require SMR or septoplasty. Okay, nowadays SMR is not at all done. Okay, it is done only if there is a gross deviation, and when you feel that there will be recurrence to septoplasty, only then you are going for an SMR. Nowadays it is always a dictum to do an endoscopic septoplasty. Okay, now so this is how a septoplasty is happening. The deviated nasal septum is made into a normal septum, right? So will you require to remove the whole deviated part for doing a septoplasty? How is it being done? All that we will be discussing soon. But before that, what are the indications of septal surgeries? One thing I told you, headache. Headache can be due to Sludder's neuralgia or sinusitis. Another thing is that when there is a eustachian tube obstruction because of the dysregulated ventilation going through the nasal cavity into the eustachian tube orifice, and when there is some kind of eustachian tube dysfunction, it can result in an acute otitis media followed by chronic otitis media. So whenever there is a chronic otitis media, and if you are seeing a patient with deviated nasal septum, it always used to be the dictum that you operate the patient before going for the surgery of the ear. Again, this is something which has been disregarded recently. Okay, earlier it used to be the dictum that whenever a patient with chronic otitis media is having a deviated nasal septum, you have to do the septal surgery as well. Now it is no longer needed. You can just straight away go for the ear surgery. Okay, when there is an obstructive sleep apnea because of the deviated nasal septum, then also you will require to do that. And as part of rhinoplasty also you will have to do. Okay, as part of rhinoplasty. So these are the various indications. Okay, and yes, there are certain contraindications. During acute infections you are not supposed to do. Okay, and whenever the age is less than 18, that is up to the age of 17, it is not an absolute contraindication. You can do septoplasty, but we'll try to avoid, because until the age of 17 there is growth in that area. Okay, so if you are doing septal surgeries, then it will affect the growth. So ideally it should be done only from the age of 18. Okay, so these are the various contraindications. Again, uncontrolled diabetes, hypertension, these are not contraindications nowadays. Okay, but acute upper respiratory tract infection we try to avoid doing a surgery. Now this is the position of the patient. The patient will be kept in a position of that is, the nose should be in upright position. There should be a flexion of the head. Okay, that is called the nasal position. A 15-degree neck flexion should be maintained, and then you can give topical anesthesia with some cottonoid which has been kept in a local anesthetic solution. Okay, now what is being done in submucous resection? First of all, you are putting an incision. The incision is known as Killian's incision. Okay, it is important that you know the name of the incision. It's Killian's incision, and it is put 1.25 centimeter behind the columella at the mucocutaneous junction, the convex side of the deflection. Again, this is not something which is not always you stick on to. Sometimes right-handed surgeons prefer to put the incision on the left side of the patient because it will be more easy for them. Okay, but if the deviation is too much, you won't be putting it in the convex side also. Okay, you will be putting in the concave side instead, because it will be difficult to put. So like that, there are certain changes. Okay, these are not strict things. So what is the most essential part of submucous resection? You will be using a Ballinger swivel knife here, okay, which can be rotated 360 degree. Okay, and whole of the quadrilateral cartilage is removed except for an area in the dorsal and caudal part of the nasal septum. Okay, the dorsal part is retained because if dorsal part is removed, it will result in saddle nose deformity, and if the caudal part is removed, what will happen? It will result in retraction of the columella. To prevent that, you are retaining those areas. Except for that, the whole of that removed. And for that, after putting the incision, you will be elevating the mucoperichondrial flap. Okay, and this mucoperichondrial and mucoperiosteal flap is elevated on both the sides, and with the help of lux forceps, you will be removing certain septal spurs, and rest of the spurs can be removed with the help of gouge and hammer. Okay, you will ask the assistant to hit on the gouge after keeping it in position. Okay, especially in the spurs. Okay, only then it will get dislocated and you can easily remove it. Okay, and this is done after elevating the flaps. Okay, this is how the septal mucoperichondrial flap is elevated on both the sides, as you can see here, and then the whole of the cartilage and bone is removed and the flap is approximated. Okay, this much area is removed. So this is what is known as submucous resection. This is a radical procedure. Okay, radical procedure.